Meanwhile, Ogun State government has since taken delivery of almost 200,000 doses of Moderna COVID-19 vaccines as it intensifies efforts to combat the third wave of the pandemic. Dr. Tomi Koka is the Commissioner for Health in Ogun State, and she joins us now for more on the fight. Thank you for taking time out. I know how tight it is for you to join us this evening on the program. Welcome.
Thank you very much for having me.
So let's begin. When Ogun State received the batch for the second phase of vaccination, you were worried that about the levels of mortality rates in the state. On some of the public health measures, and namely the non-pharmaceutical interventions, what more efforts is government applying, especially as we battle the third wave?
Well, in Ogun State, what we've done is we have a COVID-19 task force which monitor the compliance of the people. But we found that the strategy that works for us better is the risk communication, actually going out, engaging the media and advising people to continue to use the non-pharmacological interventions and providing them where necessary, particularly where there is public events where we have access to. We provide them with masks for those that don't turn up. And we also remind people that the directive of the government on the use of masks in public area still stands, despite the fact that the pandemic has been going on for over 18 months. So we don't know. We actually don't advise people to not use.
Talking about the non-pharmaceutical protocols now.
Yeah, what we encourage people to do is continue to adhere to those non-pharmacological interventions and stick to the protocol just to ensure that we don't continue to have that spread. I was just trying to remember the second question, which was round about the death rates, which we've noticed. Particularly, we noticed in the last 2 weeks that we've had a death rate of about 14 people within a period of 2 weeks. And this has raised an alarm. That's why we've come back to the media to ensure that people are aware of the rising death rate, particularly with this third wave, which we did not witness. We had about 27 deaths in the space of 4 weeks, whereas in the second wave, we had a total of about 15. And in the first wave, we had a total of about 50 over a period of 12 months. So people have to be conscious of the fact that we cannot be lackadaisical about not adhering to the non-pharmacological interventions.
And also, as much as vaccination is ongoing, they also need to continue to the non-pharmaceutical interventions. Staying with vaccination, you also receive the Moderna doses as well. But in terms of organization, are there more centers, more sites to expand vaccines and also to make sure that, there's no vaccine mixing, especially for those who might have received an AstraZeneca before and now what is being dispersed is Moderna?
So with the vaccination, initially people felt once they're vaccinated, they can do without the non-pharmacological intervention. So even though you're fully vaccinated, haven't received your 2 doses, you must continue. We received 176,000 doses of Moderna, and we have 131 sites, and we encourage everyone to go to their nearest health facility, which would be a tertiary center, a secondary facility, or our primary healthcare centers, or strategic vaccination points, because we've targeted schools, we've targeted anywhere where tertiary facilities, we've targeted prisons, just to make sure that we cover as many people in the state. Thus far, we have actually vaccinated 18,000 individuals with the Moderna vaccine. But we also have the AstraZeneca vaccine because we had a discrepancy. We had 126,000 people vaccinated with the first dose of AstraZeneca, whereas there was only about 56,000 vaccinated with the 2 doses. So the people who received their first dose of AstraZeneca vaccination should really present themselves for the second dose because we now have availability. The Moderna is solely for people who haven't had the first dose, because you have to stick to the same brand of vaccine. Once you've started with one, you can't cross over to another. So we implore people, anybody over the age of 18, to present themselves to be vaccinated so that we can work towards this herd immunity that we all keep talking about.
I must put in this question very briefly, if you can, 30 seconds. And this is for those who have taken the AstraZeneca one dose before. If the time has lapsed, what now? Do they have to start all over again?
No, you don't, because your immunity has still been sensitized. All you need to do is present yourself to the nearest facility and get your second dose of AstraZeneca, which is available across the 20 local governments in Ogun State and in all the states in Nigeria as well. And if you've received your first dose in another state or another local government, you can present to any facility, what we call super sites. The super sites will administer your second dose to you. So don't be worried if you've had it in another state or another LGA. The most important thing is to have your full course of vaccination.
We'd like to thank you, Dr. Tomi Kokais, Commissioner for Health, Ogun State. Many thanks for joining us on the program.
Thank you for having me. Cheers.
Yes, well.